Welcome to the intake coordinator training. My name is Chantel. I am the nurse, case manager, and proud owner of Shondacare. We're going to go over the role of the intake coordinator and the importance of the intake process. One thing that's really important is being prepared. Make sure that you have all the necessary forms, documents, equipment, your computer needed for the intake process. Ensure that everything's organized and easy to access. Having your systems in place is always helpful. Having your progress note ready, having your SmartCare open or the system that you use available for you. Create a comfortable environment. Make sure that the environment is welcoming and comfortable, and take steps to ensure the client feels at ease. Use open-ended questions to encourage the client to share information and feelings, and to allow for more in-depth discussions. Questions that you can ask. What kind of help are you looking for at home? Can you tell me about your daily routine and what you need help with? What is important to you when it comes to home care services? How involved do you want to be in your own care plan? What do you want to accomplish by having home care services? What are some of the challenges you have faced in the past with home care services? How do you envision your life with home care services? Those are all questions that you could utilize. Another really important task or role is active listening. Engage in active listening to show that the client that you are interested and focused on what they're saying. This helps build trust and rapport with the client. Make sure to clarify any questions to ensure that you understand the client needs and to make sure all relevant info is captured accurately. Using active listening is an important technique to use during the intake process to make clients feel heard and understood. And clarifying is just as important that they feel understood. Here are some ways to use active listening during the intake process. Give your full attention. Listen carefully to the client and focus your full attention on what they're saying. Show empathy by acknowledging the client's emotions and feelings and responding appropriately to them. Paraphrase. Repeat what the client has said in your own words to confirm you understand and show that you are actively engaged in their conversation. Ask questions. Ask questions to gather more information, clarify any uncertainties, and show that you are interested in the client's story. What's important is that sometimes you might not know what to say, but just listening to somebody is conducting initial screenings. We'll talk about the importance of that initial screening, techniques for conducting effective screenings, and documenting information accurately. So, techniques for conducting effective phone screenings. Have that script ready. Having our progress note ready to go to fill out all necessary questions will help provide you with the correct script and information and details. Listen carefully to the client's responses and ask follow-up questions to clarify uncertainties. Be empathetic and show that you understand the client's situation and be responsive to the concerns and needs. Take notes. If there are notes that might not be on the progress note or the intake information, take notes so you can reiterate it back and make sure that the team knows maybe some unique situations. Be organized. Have our progress note template and lead info open for taking notes. Ensure that all necessary fields are included. And listen actively. You can also use abbreviations, medical abbreviations when it's appropriate to save time and space in your notes. Don't leave anything out. Write down all information, even if it seems irrelevant, as it may become important later in the process. Clarify details. If you're unsure, always ask follow-up questions. Avoid personal opinions or biases. Stick to the facts and avoid including your own personal opinions or biases in your notes. Be concise. Take concise and relevant notes to ensure that all information is captured and easily accessible. Review and edit. After the phone screening or intake process, review and edit your notes to ensure that all necessary information is included and that is accurate and clear. By using these tips intake coordinators can ensure that all necessary data is captured. Gather necessary information and documentation. Ensure you obtain an email, the correct address, the correct home address. Send our welcome to Shondacare email. And you might want to ask some more questions here. So what services are you looking for? And look at our progress note sheet to have a better understanding on all the items that we need. What hours are you looking for? What is the location of the service needs? Your name, date of birth, address, email, and do you have any specific needs or preferences? Responsibility number 3, serve as a point of contact for clients and their families. It's important to have good communication and customer service skills and being able to respond to questions and concerns, even if you don't have an answer, letting them know that you will do your very best to get that answer for them. And you are the start to building positive relationships with clients and their families. Here are some tips while on the phone. Smile when speaking. I mean, it's really hard. You can see me smiling. It's really hard to sound upset when you're smiling. I mean, come on here. I'm trying to sound upset and I can't. Even though the client can't see you smiling, you can help project a friendly and approachable tone when you smile. Speak clearly and slowly, enunciating your words to ensure that the client can understand you. Be mindful of your tone. Your tone of voice, you need to pay attention to the tone of voice and try to sound warm and friendly to put the client at ease. Listen actively. Listen carefully to the client's concerns and needs and avoid interrupting or cutting them off. Repeat important information. This will help to ensure that the client understands that we understand. Use visual aids if possible, such as diagrams or charts to help explain complex information over the phone. At the end of your conversation, summarize a conversation. Summarize a conversation periodically to ensure that you and the client are on the same page and to show that you are actively listening. Follow up. Follow up with the client after the phone call to ensure that their needs have been met and to answer any additional questions. It's important that as an intake coordinator that you collaborate with other members of the team, that you participate in care plan meetings, you monitor progress and adjust care plans as needed, and knowing the importance of teamwork and collaboration. As an intake coordinator, you can contribute to care planning meetings in several ways. First, you can share the information that you've gathered during the intake process with the rest of the team. This can include information about the client's medical history, their current condition, their needs and preferences, and any relevant documentation or long-term care insurance or anything that might have been missed. You can help to facilitate the meeting by ensuring that all necessary people are present and that the meeting runs smoothly and on time. You can also help to ensure that the client's goals and preferences are accurately reflected in the care plan and in the chart. Finally, you can follow up with the care team after the meeting to ensure that the plan is being implemented effectively and to address any issues or concerns that may arise. By contributing to care plan meeting in these ways, you can help to ensure that the client receives holistic and comprehensive care and that their needs and preferences are being met. It's important that the intake coordinator ensures compliance with state and federal regulations, that we follow policies and procedures related to client intake, that we maintain accurate and up-to-date records, and that we have a good overview of regulations related to client intake and record keeping. It's also important that the intake coordinator develop and maintain a positive relationship with external partners and stakeholders. So we'll talk about some of those. Referral sources are external partners who refer clients to home care agencies. These can include physicians, hospitals, social workers, case managers, and other healthcare providers. Insurance providers We might get insurance providers who pay for home care services. This can include private insurance companies and any other government funded program. Community organizations are external partners who work with home care agencies to provide additional resources and support to clients. These include senior centers, meal delivery programs, and transportation services. Equipment and supply vendors could call to provide service needs, which this could include medical equipment suppliers, pharmacies, and home health supply companies. Caregiver organizations are external partners who provide support to family caregivers who may be providing care for loved ones in the home. These can include caregiver support groups, respite care providers, and educational resources. By working closely with these external partners, home care agencies can provide the best possible care to their clients and to help ensure that the clients have access to the resources and support they need to live safely and independently in their homes. In conclusion, I'd like to just take a last moment to express the importance of the role of the intake coordinator and really truly thank you for your dedication to our mission, providing holistic and compassionate care. The importance of the intake coordinator is of great value. The intake coordinator is often the first point of contact for potential clients and their families. They have the important responsibility of making a good first impression and setting the tone for the rest of the client's experience with this home care agency. Assessing client needs, the intake coordinator is responsible for gathering information about the client's needs, preferences, medical history. This information is essential for creating a personalized care plan that meets the client's specific needs. Coordinating care. The intake coordinator works closely with other members of the care team to coordinate care for the client. They ensure that all necessary services and resources are in place and that the care plan is being implemented effectively. Managing documentation. The intake coordinator is responsible for managing the client's documentation, ensuring that it's accurate and up to date. This includes any medical history and other important documentation. Ensuring compliance. The intake coordinator is responsible for ensuring that the home care agency is compliant with regulatory requirements and documentation to make it complete and accurate. Providing support. The intake coordinator provides support to the client and their families throughout the intake process and beyond. They answer questions, provide information, and offer guidance as needed. By fulfilling these important responsibilities, the intake coordinator plays a critical role in ensuring that clients receive the best possible care and that their needs are met in a holistic and comprehensive manner. I want to thank you for taking the time, and I look forward to working with you as an intake coordinator. Namaste.